Yes. Thank you.
Hello, good afternoon. Thank you very much for a very, very interesting discussion. I found all kinds of opinions, many positive, negative, and of course, diverse perspectives. So if I could ask a question, and in a nutshell, from each one of you, just in a nutshell, like one sentence, the last question that you answered, how do we emerge stronger from this coronavirus experience? One sentence from each of you. I'm sure we can sum it up.
Let me start. I believe that we will become stronger the day we will manage. I'm not saying that this is the most important, but it's an element that I'm sure complemented between all of us will result in a concept. But in my opinion, egos are to be managed for coordinating the international response. In my experience, the ego and the territoriality in wherever space you are plays against collaboration and multi-stakeholder partnerships.
Yeah, I think international collaboration and in a local area, public and private sectors collaboration is more effectively in the future because we listened from COVID-19 testing. Yeah.
Well, despite the sort of pessimistic note on which I ended, I must say that health is an issue that transcends all others and transcends formal borders, and everyone understands that our own health as individuals or at national level is interdependent with the health of the others in the world. So I'm confident in the mid and long term that the world will come together to deal with global health related issues.
I think it's from this coronavirus we learn how to, it's important to be together to collaboration between country to run out of this pandemic. And I think the world is, it's already got learned from this pandemic, hoping they are ready for the next one.
I think that there's a lot of research to be done in the coming years, and some countries has been doing much better than other countries. And I think that one of the key points here is that health professionals need to understand that politicians take the decisions and accept their role, and the politicians need to understand that the health profession has the knowledge and not take the decision without. So both groups need to respect each other and understand each other's role in the play. Those countries who have a good communication between politicians and health professionals have definitely fared much better than countries that, and I'm not mentioning anything here, but I think that is a very important issue. We each has a role to play, and we have to recognize that.
Yeah, thank you very much. As I explained before, I think we will be better in the position in the next pandemic because it's what experienced in Korea. We prepared for 4 years after the MERS outbreak, so we could respond better. So I think nation and the international agencies needed to review the lessons learned and need to prepare for the next pandemic. That will be the only way to overcome the next pandemic through the public-private collaboration and innovative ideas. Thank you very much.
Any other questions or comments or ideas? Yes.
I don't know if there's... Yeah, so thank you so much for the wonderful discussion. I really have enjoyed it. Although there were some pessimistic approaches, but actually, all in all, it was really wonderful. But I would like to know your opinions about information technology and how it mastered the game. In some countries, talking here about the GCC specifically, we do have applications here in the United Arab Emirates, as well as in Saudi, that you can have everything about your personal data, about vaccination, about testing. And I don't know about how the let's say the West is doing, because there are some human rights issues about that. And what do you think about this point? Thank you.
Anyone? Dr. Peterson?
Yeah, no, but we actually do have that in the Scandinavian countries also. Everybody has a personal ID number, and if you use that, you can log into all your own data, no matter whether it's COVID-related or hospital or your general practitioners. So we are used to electronic communication, but it has taken many years, and it has not been cheap. But I think it's a very nice way of having it. You're moving away from having everything on paper, you have it on your mobile, but it's highly strictly confidential, and and that is very important. So personal security of your data is key here, but of course we have to go away from all these papers.
Any other? Dr. Lee? Professor Kazatsky?
Well, you're raising, a big issue that started in the times of Pasteur about, personal freedoms versus collective interest. But to the specific point, and following up on what Professor Peterson said, where people are troubled in where I live, in France and Switzerland, is about citizens, like someone in a bar or in a theater, looking at your passport or identity. So not only do you show a COVID pass, but you are also asked by a fellow citizen to show your identity, which I think raises some issues.
I must definitely say that I absolutely disagree here. I'm used to being asked to show my driver license if I've stopped by the police, and the driver license gives my fellow drivers an assurance that I at least have passed a test. Some say, even though for me it's 50 years ago I passed a test and I couldn't do it now. But you are not objecting to showing your driver's license. So why are you objecting to showing an immunization? And we know that from the yellow card. I've been immunizing people going from Denmark to Brazil, and they need a yellow fever vaccination on your yellow card. And there was never any problems there. So why is it now a problem? I really don't understand that.
No, I'm not objecting showing my driving license to a policeman, that is to the public authority. I think where the issue is about private citizens now having knowledge of private identities. And again, what I said is that I see this emerging as a concern in countries where it's not the public authority, but a delegated authority to citizens to control each other that is given. A nuance, yeah?
Any other questions?
Yeah, this.
Yeah.
I'm Dr. Bashar from Jordan. I'm the General Director of PML Group, Precision Medical Labs. Thank you so much for the very valuable seminars today. My question, that we are facing very serious manipulated virus. And maybe you are not agree with me about manipulated virus, but it is serious virus and very infectious, like Omicron. It is very infectious, but actually it is weak little bit by the contagious virus. It is not as Delta and others. My question now, what are your expectations for the new mutations for the future? You know, it is multi-mutational virus. What do you expect for tomorrow? It will be serious, contagious, or weak, so we can accommodate with the virus and we can open all the sectors what we can help our community to say. Thank you so much.
I would like to hear Dr. Lee's comment about that. What do we expect as the next outbreak?
In general, virus mutated, the pathogen will spread very rapidly, but the seriousness is less than Delta or other original sequence, I think.
Dr. Go? Dr. Peterson, sorry.
I think that the Omicron variant is as pathogenic as the original Wuhan virus from January 20. You cannot predict whether the next variant will be more or less pathogenic. That's impossible. This is a zoonotic virus. It can move into animals and back to humans. We have an outbreak in hamsters in Hong Kong right now. So my best prediction is that when we are over the Omicron outbreak, there will be a new variant coming in next autumn. We need new generation vaccines incorporating Omicron and Delta variants, and then we'll all get a shot in the autumn. This is not surprising. This is how it is for influenza. But this is what I expect, and I've been terribly wrong before, so so that's how it is. But this is a virus that's here to stay, especially because it's zoonotic, and it can go both ways. It can become milder, but it can be more pathogenic. It's like influenza. Some of them are mild, and then you can have a very severe pandemic like the 1918. It's not predictable, in my view.
Okay. Some others? Dr. Saeed.
I think this is a very contagious virus. When we start in Saudi, in the first week of Omicron, was 1% from the positive cases is Omicron. Last week, we reached 97% from the positive cases is Omicron. And they is not start like stopping sequencing, but they are use specific centers who have like high demanding patient came for vaccination and for the swabbing to do the sequencing to reduce the cost of sequencing. And my opinion is like this Omicron, it could be like is 50-50. It could be like killing of the virus mutations, or could be like generating another contagious virus. But for community, we need to live with this virus. We not be able to lock down everything and squeeze the people from their normal life. Thank you.
Excuse me, please. Can I take another question? Dependent about the replication of viral growth cycle, do you think the coronavirus, COVID, taking some rest stages now to go strongly for future, and will be more contagious mutations? And for how long?
Professor Kazatsky.
The consensus we have here on the panel is that we cannot predict anything beyond the next 3 weeks at this time. And every scenario can be considered for the future, from, as Dr. Peterson had said, the mildest, or a move to a seasonal endemic virus that would be of less aggressiveness, to the worst case scenario of a totally unexpected variant that would be very aggressive. So I don't think we can answer your question except by saying that we're still not investing enough at national and international levels into pandemic preparedness.
Can I add?
Yeah, sure.
Daniel?
Dr. Gong, sorry.
Thank you very much for your very valuable questions. I think that predicting the severity of new virus or variants of this coronavirus, we cannot predict exactly. That's why we need surveillance system. As Dr. Kazakhstan mentioned, that's why we need to test and then extract the virus and send it to public and do the sequencing work. It's very labor requiring work, but we need to that. We need to follow the cases, number of cases. We need surveillance about, and we need to check the mutation of virus, and yeah, at that point we need to collaboration with private sectors also, because most patients visit clinics and hospitals in private sectors. So to prepare for the next pandemic, like a disease X, we need to include some way the hospitals and laboratories in private sectors, and we need to somehow develop the global diagnostic surveillance network, which include the private sectors, to predict and monitor the new virus emergence and the variant. Thank you very much.
Any other questions or comments? I think that with that, thank you very much to all the panelists, and thank you for coming. It has been a pleasure. So thank you very much. Thanks.